I'm Dr. Stoehr, and this is Feminine Curiosities. I am doing a new and unique video today, and we are going to get this first shot because I am teaching my daughter, Naomi, right here. She is 10 years old, all about what's going to happen when she starts having her period. And I'm hoping all of you moms out there and dads out there that are needing help with your tweens, that this may be super helpful. So this is an honest, open, and not controlled environment here. I have no idea what Naomi's going to ask me, and I'm just going to kind of wing this as a gynecologist, okay? So Naomi is 10, in the throes of puberty. We are yes, the cat's saying hello at the door. Stop giggling at the cat so it gets...
Sorry.
Okay, it's okay, no worries. So you've already got some body hair, armpits. We've talked about potentially shaving. I know that's kind of a weird sore subject for you. We've already started wearing some training bras. Mommy bought some training bras, and those have been going really well. Yeah. Okay, so one of the things that I know you already know a little bit about is when your periods actually start, what to do. So do you want to tell all of my friends out here what Mommy put into your emergency bag for school?
Some pads and some period underwear, I think.
Pads and period underwear, and do we put in a change of clothing too?
Yeah.
I think we put in a change of clothing too, and some wipes. So I know you know that what happens when your period starts is that blood starts coming from your vagina. And I know you know where your vagina is. So one question I have for you is, do you know why girls have periods?
Not really.
Not really. Okay, so there's something new for us to discuss. So up inside the vagina, there's something called your uterus and your cervix. Your uterus is kind of like a ball-shaped organ that sits way down in your pelvis, and a little piece of it called the cervix sticks down into your vagina. Okay? And every month, every girl that is past puberty and into having their periods will grow a lining inside that uterus to potentially hold a baby. Okay? That lining that you grow every month is where a baby implants and decides to grow. Now, the baby is made from an egg that comes from mommy's ovaries and a sperm that comes out of daddy's penis. And those two will meet and make a baby inside the uterus. Okay? So every month, if you don't have a pregnancy, which please don't have a pregnancy until you're like 30. I'm joking. If you want to have one at like 27, it's totally cool. But yeah. So as long as you don't get pregnant, all of that lining that was meant for a baby to like pull its little covers over has to go somewhere. And what happens is your body gives a little signal from your brain, and it tells your uterus, hey, now's the time to let that lining go so we can prepare for a potential pregnancy next month. That shedding out of the uterus of all of that extra tissue is what comes out with your period. Okay? Any questions about that? That was a lot of information kind of all at once.
Well, is the period just supposed to be blood?
The period is blood, and it's tissue from inside the uterus. Usually all you'll see is blood and maybe a little bit of kind of thin, chunky clots. That's it. Yeah, so sometimes you'll see some stringy stuff. Sometimes you'll even see some brown stuff. The brown stuff that comes out is old blood. And what I mean by that is sometimes it kind of gets caught up inside your vagina for a little while. And when blood kind of hangs around for a little while, you know, it kind of turns a little bit of a different color, like a scab. That kind of color may come out as well. Okay? Other questions about the period itself and how it starts and why it happens?
Not really.
Okay. So the other thing that's really important, now that you know that the period is part of what helps you carry a baby, that also means there's a very big responsibility once you start having periods, because now you could get pregnant. Okay? So until you are ready to have a baby, you'd want to make sure that you protect yourself against pregnancy whenever the time comes for that. And I'm not going to give you the sex talk now because I think it's 10. That's probably a little too early to talk about that. When you get a little bit older, maybe I can convince her to film that one too. We shall see. But the one thing that's important to know is not to have sex until you're ready to take on the responsibility of a baby, because that's what your periods are for. And once you start having periods, that is a possibility. Okay? All right. So the blood itself, do you know how much blood comes out during a typical period?
Not really.
Not much.
Okay.
It may feel like a lot, but usually it should be only enough to change those Thinx underwear. That's the brand. I have no affiliation with any of the period underwear. We just happen to have gotten the Thinx brand. That underwear should not fill up more than twice in a day. So in the total time of your period, which usually lasts anywhere between like 3 and 6 to 7 days, you shouldn't lose more than about a small cup of blood. So like a cup that's about this big around and about that tall.
Medicine cups that we have?
A little bit more than a medicine cup, yeah. So 80 cc's is the max. Those medicine cups usually go up to about 30 to 40 cc's. So yeah, not a lot of blood actually comes out, but it may feel like a lot when you're wiping and there's little clots and it's messy. Okay? All right. So not that much blood, but enough to kind of make you go, ooh. All right, I'm going to keep that clean down there. All right, so there's lots of different ways that you can control for the messiness of a period. I love the period underwear for not having to worry about stuff, but one question a lot of my patients often ask, and I'm sure you're probably thinking, is how do we go to the pool when we're on our period? Because we love to swim. So there's a couple of different ways you can go to the pool. One of them would be to use a tampon. And tampons you've seen tampons before, right?
Yeah, but I don't know how they work.
Don't know how they work. Okay. So normally for somebody your age, if we were using a tampon, we would use a really small one because you have a fairly small vagina right now and you're probably not going to be bleeding very extensively. So just a little small tampon would be fine. The tampons actually go up inside the vagina and then you kind of push them through their applicator. They usually come with an applicator. And then it's just a little piece of cotton that sits up in the vagina and absorbs the extra blood. So it absorbs the blood while you're in the pool. Another option is something called a period cup. There's a lot of different types of little tiny, they're made out of silicone, so they're kind of like really flimsy plastic. And you can fold them up, kind of like origami style, and you can put those in the vagina and then they pop open when they go up to the vagina. And then the blood can collect in the cup while you're in the pool. So those are two different options for going to the pool when you're on your period. It feels a little weird going in when you're first using it, and I wouldn't necessarily recommend that for a 10-year-old. Mainly because even the smallest cups are probably a little bit bigger than what would be comfortable going in there. But once you're like 13 or 14, yeah, we can absolutely do a period cup. That's what I liked using. There's a couple of reasons for that. Number one, I think it's less messy. And number two, I think it's in general better for the environment because you can use one of those period cups for several years. And tampons you have to keep throwing away. And unless they're biodegradable, which some of them are and some of them aren't, especially the applicators, that's not really great for the environment. Okay, so that's how we go to the pool. We use a tampon or a period cup. Okay, what questions have you got about starting your periods now?
What if it happens at school?
Okay, so that's why we have the emergency thing for school. The first thing you need to do if you go to the bathroom, you notice, oh, there's some brown stuff coming out. That's not poop. You haven't had an accident in many, many moons, but it's not poop coming out. It's just blood coming from a period. Go to the nurse and let them know. Say, Mrs. Nurse, I think I might be starting my period. My mommy has got me an emergency pack here. I have a change of clothing and some extra underwear, but can you help me in case I need it? And your nurse is going to go, yeah, absolutely. There's a bathroom right here. I'll come with you. I'll stand outside the stall, and if you need any help, I'll be there. Okay? Usually the first period is fairly light, and it's more of like a brownish kind of gooey discharge. Sometimes people have full-on bright red periods with the first one. The brownish discharge, you might not even notice until you get home and you take off your underwear a second or third time. You're like, wait a second, what is that? But if it's bright red blood, you'll probably notice. Okay?
So each time it does bleed, is there like a bunch or just like a little bit?
Just a little bit usually. Now, some people have heavier periods than other people, and it's hard to know who's going to be who. So if you happen to have the heavier periods, it may be a little bit more blood than that, enough to kind of make the Thinx underwear sort of heavy and a little bit full. And if you were using a pad, it would probably be enough to fill the pad in a couple of hours. Usually we say if you're filling a regular size or a heavy pad in 2 hours or less, we need to let the doctor know. Since I'm a doctor, I can help you out with that. But for you guys out there, if your daughter is bleeding more than 2 pads per hour, you need to let me know, okay? All right. But every time you have a period, there'll be just a little bit of blood that'll come out slowly but surely over like 2 to 7 days.
So you're always bleeding?
For 2 to 7 days, a month. You get 3 weeks
off.
off.
I thought it was just like you bleed and then you stop bleeding and you bleed again.
Yep, that's pretty much how it goes.
Wow.
So you bleed for about 2 to 7 days, and you'll bleed that entire time.
Like I thought you would like bleed for like maybe like a few like minutes, and then it
comes and
again,
goes.
and then it just comes in a couple hours, and then it just goes.
It bleeds slowly but surely over the entire time of your period.
Oh.
So every time you go to the bathroom, there'll be a little bit more blood on your pad or your Thinx underwear.
Uh-huh.
With Thinx underwear, they do hold a lot of blood in them, so you won't necessarily need to change it every time you go to the bathroom.
Okay.
But you may feel the need to go to the bathroom to clean up a little bit more frequently. Okay, what other questions have you got?
Not really.
Not anything? Okay, so one of the things that we have already had with you is some cramps. And we weren't sure if those cramps were coming from tummy upset or if those were coming from a potential period starting.
Uh-huh.
So cramps are not uncommon during your periods. Usually they start a day-ish before, sometimes 1 to 2 days before the period. And they'll usually last through the first 1 to 2 days of the period. Those should be not unbearable. You should be able to kind of push through them, and they should get better if you take Motrin or Tylenol. Motrin typically works better. Okay? So if you start having some kind of weird crampy, like, what is that sensation? It feels kind of like maybe I need to poop. Let mommy know. We'll get you some Motrin, and that'll help with the period cramps. Okay? All right. Any other questions?
No.
Not at this point?
No.
High five. Everybody, thanks to Naomi for letting me actually video this. This honestly is the first time that we've ever talked about this in depth. So this is exactly how I talk to my daughter about starting her periods. And if you would like to use this to show your daughters, feel free. Say bye.